Hi, our topic today is about the premalignant condition. Premalignant lesion. What is the premalignant lesion? It's morphologically altered tissue. As we see in this area, there is a slight alteration. Premalignant condition, a generalized state associated with a significantly increased risk of cancer. Risk factor is tobacco use, nutrition, alcohol use, infective agent, age, poor oral health. Diagnostic aids. One of these diagnostic aids is vital tissue staining. Use metachromatic dye that has an affinity for tissue expressing high cellular activity. Tissue that retain the dye appear dark blue clinically, as we see here, it's appear dark blue. Other type of the diagnostic aid is light-based detection. This system acts as visualization aid to facilitate accurate localization of dysplastic or neoplastic mucosa. Brush biopsy and exfoliative cytology and salivary analysis. Brush biopsy is based on the analysis and interpretation of characteristics of the cell sheet from a mucosal surface. Salivary analysis it consists of analysis of salivary composition and the shed oral epithelial cell. Diagnostic method. Patient history. Detailed history is obtained from the patient with emphasis on identification of risk factor and recognition of medical condition predisposing to premalignant lesion or condition. Clinical examination involves inspection related to vision, that we see if there is any lesion in the mouth. After detect that any lesion present in the mouth, we should palpate it. Any detected lesion should be palpated by a gloved finger to determine its texture. Photograph. Clinical photographs of any lesion may be helpful during follow-up visit. This some photograph of the lesion. As we see in this picture, we see the progression of the lesion during different visits. Investigation. There is different investigation: blood investigation, oral swab, biopsy. Pre-malignant lesion, we have many types of the premalignant lesion that we mention to the three of them here: leukoplakia, erythroplakia, and the leukokeratosis. Leukoplakia is defined as a predominantly white lesion of the oral mucosa that cannot be characterized as any other definable lesion. Etiology of the leukoplakia there is different etiology: tobacco, alcohol, chronic irritation, candidiasis, electromagnetic reaction, vitamin deficiency, xerostomia, and others. Clinical feature of the leukoplakia. It's occur in the male more than female and in the age between the 35 to the 45. It's occur in different sides of the mouth, as we see in the palate, in the buccal mucosa, in the tongue, and in the floor of the mouth. Have different type, homogeneous leukoplakia and non-homogeneous leukoplakia that have irregularities. This homogeneous type and nodular type that we see in nodular type there is an increase in irregularities and ulcerative type. Malignant transformation occur in 0.3% to 10% and in women more than men. Differential diagnosis: leukoedema, lichen chemical burn, lupus erythematosus, white sponge nevus. Diagnosis: elimination of other white lesion as differential diagnosis and biopsy. How we take biopsy is defined in this picture. As step 1, determine the lesion, the border of the lesion, and then cut the lesion. We can take all the lesion or part of it, then suture the place, and we send the sample to the laboratory for the histopathologic investigation. The grade of epithelial dysplasia refers to its severity or intensity. Mild epithelial dysplasia refer to alteration limited principally to the basal and parabasal layers, and moderate demonstrate involvement from the basal layer to the mid-portion of the spinous layer. Then the severe demonstrate alteration from the basal layer to the level above the midpoint of the epithelium. And carcinoma in situ is defined as dysplasia involving the entire thickness of the epithelium. Treatment: elimination of etiological factor. B. Conservative treatment. C. Surgical management. Surgical management involves scalpel excision, that means wall of patch can be taken in one piece as we see in this picture. Electrocautery. The healing process is slow and painful. Other method, cryotherapy, is method of super freezing tissue in order to destroy it. CO2 laser therapy. There is two techniques. One of these techniques that determine the lesion, the border of lesion, and cut the border of lesion by laser that can take the patch by the forceps. Other technique is that move the laser forward and backward for vaporization of the lesion. Erythroplakia. Any lesion of oral mucosa that presents as a bright red, velvety patch or plaque, which cannot be characterized clinically or pathologically as any other recognizable condition. As we see in this picture, there is red patch on the palate. Etiology: there is different cause for erythroplakia: tobacco use, alcohol use, candida infection, or for unknown cause. Clinical feature: it's red as we see, there is red patch. most commonly present in the floor of the mouth, may be present on the tongue and on the mucosa, usually asymptomatic, may be smooth or nodular, and occur in male more in the sixth and seventh decade of life. More occur in the floor of the mouth as we see in this picture. Treatment. The treatment is same as that for the invasive carcinoma like surgery, radiation, and cauterization. Surgical excision if proven dysplastic or malignant. Other types of the oral lesion is leukokeratosis nicotina palati or smoker's palate. It's occur in those that use tobacco. Some of these lesions may transform into cancer. As we say before, that etiology is tobacco use. Clinical feature is as this picture, there is palatal change and inflamed ductal opening. Treatment, discontinuation, biopsy, and excision.
مرحبا. راح أتكلم عن البريماليجنانت كونديشن، وراح أبدي بأول موضوع هو الأورال submucous fibrosis. It is a chronic disorder characterized by fibrosis of the lining mucosa of the upper digestive tract, involving the oral cavity, oropharynx, and frequently the upper third of esophagus. Etiology: chewing of betel liquid, excessive consumption of spices, deficiencies of iron and vitamin B, bacterial infection, immunological disorder, nutritional deficiency, and genetic disorder. Staging of oral submucous fibrosis عبارة عن 3 stages. Stage 1 stage of stomatitis and vesiculation, Stage 2 stage of fibrosis, Stage 3 stage of sequelae and complication. This is stage 1. Stage of stomatitis includes erythematous mucosa, vesicles, mucosal ulcers, and melanotic mucosal pigmentation. Stage 2, there is inability to open mouth completely and stiffness in mastication. As disease advances, there is difficulty in blowing out cheek and protruding tongue. Sometimes pain in ear and speech is affected. On examination, show an increasing amount of fibrosis in the submucosa. This causes blanching of mucosa. Stage 3, patient, patient presents with all the compliance as stage 2. Also, there may be evidence of leukoplakia. Changes in mucosa are whitish or brownish black. Differential diagnosis: scleroderma, fibroma, generalized fibromatosis, anemia, amyloidosis. Diagnosis: Diagnosis of oral submucous fibrosis is based on clinical signs and symptoms that include burning sensation, pain, and ulceration. Progressive restriction in mouth opening, blanching of the mucosa, depapillation of the tongue, and loss of pigmentation are other classic features. Dysphonia and hearing impairment is also observed in advanced cases. Treatment: nutritional treatment like lycopene and B complex. An intralesional injection of corticosteroids, interferon gamma, and proteolytics used to prevent or suppress inflammatory reaction, thereby preventing fibrosis by decreasing fibroblastic proliferation and deposition of collagen. Surgical treatment for moderate to severe cases may require surgical splitting or excision of the fibrous bands with or without grafting by skin graft, or using flaps followed by lifelong physiotherapy. Lichen planus. It is a chronic mucocutaneous disease that can affect the skin or mucosa. Clinical feature. The most commonly involved sites are buccal mucosa, gingiva, and lateral border of the tongue. The prevalence of oral lichen planus is between 0.1% and 0.2%. It occurs in middle-aged adults with female predilection. Symptoms: burning sensation of oral mucosa and appearance radiating white, lucky patches, and swollen tissues or open sores. Types of lichen planus. Two main types of oral lichen planus have been described: reticular and erosive. Other types of lichen planus: papular, black-like, atrophic, and bullous. Reticular lichen planus. Most common type usually arises in the buccal mucosa bilaterally and characteristically has fine radiating white stria known as Wilhelm stria, which may be surrounded by a definite erythematous border. It is usually asymptomatic and usually can be diagnosed by its clinical features. Erosive lichen planus, it appears as irregularly shaped, which may be covered with a fibrinous plaque or pseudomembrane over the erosion. This type is symptomatic and has a greater potential to undergo malignant change. The two types with an increased potential to undergo malignant transformation are the erosive and atrophic type. Differential diagnosis: cheek chewing, lichenoid reaction, leukoplakia, lupus erythematosus, pemphigus, mucous membrane pemphigoid, chronic ulcerative stomatitis. Your doctor makes a diagnosis of oral lichen planus based on discussion of your medical and dental history and medications you are taking, review of symptoms including lesions in your mouth and other places on your body, examination of your mouth and other areas are as appropriate. Also may request lab tests such as biopsy, cultures, and blood tests. Treatment: topical or systemic corticosteroid therapy is the mainstay in management of symptomatic oral lichen planus. Other agents such as cyclosporine, tacrolimus, dapsone, الازثيوبرين والليفاميسول. الactinic cheilitis, also called actinic keratosis, solar cheilitis. It is a common potentially malignant alteration of the lower vermilion lip that results from long-term or excessive exposure to the ultraviolet component of sunlight. Other risk factors: fair complexion, old age, immunosuppression, arsenic exposure, certain genetic abnormalities. The clinical features of actinic cheilitis is usually occur in individuals older than 40 years with male predilection. Early clinical changes include atrophy of the lower lip, vermilion border, blurring of margin between the vermilion zone and the cutaneous portion of lip is seen. As the lesion progresses, rough scaly areas develop on the vermilion. These areas thicken and may appear as leukoplakic lesions. Differential diagnosis: epithelial dysplasia, squamous cell carcinoma, malignant melanoma, basal cell carcinoma, glandular cheilitis, herpes labialis, discoid lupus erythematosus. الدايجنوسيس أولاً الفيديوسكوبي. It is a diagnostic tool used to select the biopsy area for actinic cheilitis diagnosis on the basis of examination of images of the lower lip under magnification and sufficient lighting. It is also employed for the follow-up of treated patients because it saves the actinic cheilitis images at each visit, which helps to compare the effectiveness of treatment and the changes at different stages of treatment. Patch test. Actinic cheilitis due to an allergic reaction is diagnosed through the patch test. A patch which is pre-coated with 65 allergens is made to come in contact with the lips. Among the 65 allergens, the patient's lip will be hypersensitive to at least one patch allergen, which through serial interpretation is recorded as the cause of allergic actinic cheilitis. Treatment: instruction of patients to avoid direct exposure to sun and using sunscreens, areas if indurations, thickening, ulceration should be submitted for biopsy to rule out carcinoma. Lip shave, vermillionectomy. In cases of dysplasia, the vermilion mucosa is excised and the labial mucosa is advanced to reconstruct the vermilion. Alternative treatments: laser ablation. This therapy employs a particular wavelength of light that interacts with the lip tissue to treat actinic cheilitis. Carbon dioxide and erbium lasers are commonly used in this treatment. Cryotherapy. This therapy utilizes extreme cold temperatures to treat the lesion. Cryotherapy specializes in treating localized cancers, which include the carcinogenic stage of actinic cheilitis. Photodynamic therapy. This therapy employs photosensitizing drugs such as methylaminoxybentonate, fluorouracil, to make the abnormal cells of the lesion susceptible to light-induced damage. These drugs are effective only in the presence of a specific wavelength of light, which differs from one to another. Anesthesia is administered for the control of local pain during the treatment. Sometimes natural daylight is the active agent when certain photosensitive drugs are used. Thank you.